For some women, it's a natural part of the aging process, peri-menopause, a shift in their bodies toward complete menopause when their reproductive system shuts down. The process can bring on often uncomfortable changes that make it difficult to get through the day and night. Lurene Cachola has more on how to deal with these changes.
After a long day at school, third grade teacher Patty Lewis still has the energy to get through chores and other tasks around the house. But that wasn't always the case. She could get through the day, but would be ready to crash when she got home. And after she was in bed, she had trouble sleeping through the night.
When I first had the first hot flash, I really didn't know what that meant. I thought, well, it's just like when it's hot outside. I had no idea it was an internal heat that you can't just relieve with air conditioning. It wasn't like that.
Hot flashes and sleep problems are just two of the symptoms of perimenopause, which is also called the menopausal transition. During that transition, a woman's body shifts from regular cycles of ovulation and menstruation to permanent infertility.
In most women, it takes a couple years before they actually reach true menopause. And menopause means they have not had a period for a full 12 months. But in the few years before that, they can start having, most noticeably, some irregularity of their periods. They can start having some hot flashes, and that's what perimenopause is. It's the symptoms of menopause before they actually reach true menopause.
Women experiencing perimenopause also experience a risk of bone loss and increases in so-called bad cholesterol. And hot flashes happen to as many as 75% of women in the later stages of perimenopause. That can trigger mood swings, irritability, or even an increased risk of depression. But because the onset of symptoms can be subtle, women may not realize all the changes they're seeing are connected to changing levels of the key female hormones of estrogen and progesterone.
And so we really talk to the patient and see what kind of symptoms they are having. Mainly the hot flashes and night sweats, and discuss whether hormones are right for them, or trying some other lifestyle changes can sometimes help. And then also patients a lot of times have some difficulty with their mood during this time, mood fluctuations up and down, so if we need to be even on an antidepressant to help them just get through this time period.
We started out with a very low dose medication, that hormone replacement, just to see if I could tolerate that, if it would help remedy the problem. It took a little fine tuning to get the dosage where I needed it. It was a little bit too strong. She kind of worked with that, and getting it to where my symptoms were disappearing and I was feeling back to myself. That really was how we dealt with it.
Lewis worked with Dr. Bishop and saw relief from hormone therapy after giving some alternative medicine approaches a try. Techniques such as regular exercise, good nutrition, and efforts to reduce stress can also ease symptoms. For this teacher, the lesson was knowing when to seek more information.
I think the most important thing is to know your doctor, to be comfortable asking questions of your doctor, to speak to other women, and really just be honest about how you feel, what questions you have. Don't hesitate to have a good relationship and ask your doctor or your nurse very frankly, this is happening to me, is this normal?
For Smart Medicine, I'm Lurene Cachola.